Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. What actually occurs when you sprain your ankle? Well, first and foremost, the talus bone, which connects the foot to the lower leg area, subluxates or goes out of position, and this is really the cause of that incredibly sharp pain, stabbing pain that you experience. Secondly, the ankle ligaments are frequently sprained and may very occasionally completely rupture, tear apart. Fortunately, this is very, very rare, and the sprain is the most likely cause of the bruising frequently associated with a sprained ankle. Also, the muscles or tendon may be strained, and lastly, a fracture may occur in rare instances, usually the lateral malleolus or the head of the fifth metatarsal. The lateral malleolus is the bone you feel on the side of your ankle, and the fifth metatarsal is the bone that goes between the little toe and your heel, and these can be either Jones fractures or avulsion fractures. So, chiropractic management of ankle problems, ankle sprains, first of all, warrant typically an x-ray. It's important before the chiropractic ankle sprain treatment. If there's any suggestion, especially of a possible fracture, depending on the trauma, so you want to get an x-ray. And then you don't want to adjust a fractured joint because that'll obviously aggravate it. And to facilitate a normal and quick recovery, the first treatment is to adjust the subluxated talus bone. There's no fracture, of course, and this is not usually particularly painful, but can be done with a standard chiropractic technique, and this restores the normal biomechanics and enhances the normal healing time of the joint. If there is a fracture, usually of the large bony hump on the side of the ankle, which is your lateral malleolus, or bone in the very side of the foot, head of the fifth metatarsal, then casting the ankle by an orthopedist is generally recommended. Sprain and strain of the ligaments and tendons is done treated using the RICE protocol. Basically, this means rest, ice, compression, bandage, and elevation. And then cold-hot therapy, where you alternate ice and heat. Usually more than one tissue is injured, and unfortunately the treatment of one, like a fracture, may contraindicate the treatment of another, like ice on the sprain or adjusting the talus bone. Fracture will always take precedence, so you want to get it casted. The talus can always be adjusted once the fracture is healed. And so this is very important to keep in mind. Also, ankle sprain treatment should always include some kind of rehabilitation too, exercises plus stretches and muscle strengthening techniques. Otherwise, you may be just laying yourself open to another injury that could be just around the corner, or the likelihood of a nasty chronic plantar fasciitis that occurs next. And a good ankle stretch is typically to kneel on the carpet with your toes pointed out behind you, sit back on your heels, pressing them gently down towards the carpet. And you should feel the stretch in the front and sides of the lower leg, but not the calf. Another really good stretch is for the Achilles calf muscle area. So stand about 1 meter from a wall with one foot forward, knees slightly bent, and the other straight with the heel firmly on the ground. So lean forwards, first with one leg straight and then slightly bent at the knee, and then strengthening weak muscles and stretching damaged ligaments so they remain flexible, mobilizing the subluxated or misaligned joint, and then reestablishing what's called the proprioception are all important parts of an ankle sprain treatment. Proprioception being getting your balance and position sense back in line so that you're less likely to fall and sprain it again. Wobble boards are also an important aspect of chiropractic ankle exercises. They're easily available. You can buy them in most orthopedic sports supply stores, and they really make a difference. So you can ask me where you can buy one locally here in Fountain Valley, or they're easy to buy online as well, or even turn on a lathe if you're at all handy with woodworking. So as you can see, chiropractic management and care of sprained ankles is extremely effective, and should, in the absence of fracture, should definitely be used first before any other methods like injection shots or casting or surgery or anything like that. Chiropractic is extremely effective, and we're always available here at New Hope Chiropractic to do a complimentary consultation to see if we can help you chiropractically with your sprained ankle. And you can always check us out online at newhopechiropractic.com or my blog, newhopechiropracticblog.com. And in the meantime, have a healthy day.